Well, good afternoon, everyone, and I would like to welcome you and call to order our Middlesex County Council meeting for Tuesday, August the 10th. I think there is no doubt that we are now in the dog days of summer. It is hard to believe that we are just about at the mid-August point, and many of us are gearing up for AMO next week and trying to cram last-minute vacation plans into our busy schedules. I do hope that you have all found time to relax and refresh during the incredible summer we have all enjoyed until now. I don't know about you, but I'm feeling a bit lost without the Olympics on in the background. What a great distraction it has provided so many of us. It is always thrilling to watch our athletes push themselves to limits that many of us cannot even fathom. London was certainly well represented on the podium, and I know you all join me in sending congratulations to the athletes from our region who participated and to the many that medaled. From a COVID perspective, the numbers in our region have, for the most part, flattened and remained constant. This, of course, is because of the overwhelming success of vaccinations. Both the MLHU and, of course, our own MLPS has made getting a vaccine very easy. From pop-up clinics to drive-thrus and walk-in availability, access to the vaccine has greatly improved over the last few months. Here at the county, we are still taking a cautious approach, and that's why we are meeting today virtually. The next few months will prove to be important. Even though the landscape looks good today, and we are so fortunate that we are in a mode where we are heading back to the way things used to be, we must be mindful that things can turn very quickly. The Delta variant does cause pause for concern. So with that in mind, take advantage of the incredible summer we are experiencing and enjoy the outdoors with friends and family as much as possible. Continue to wear a mask and get vaccinated. Is there any disclosure of pecuniary interest? Okay, our minutes are in front of us for July 13th. Was there any business arising from those minutes? So you've all had a chance to go through and review the minutes. And if nothing needs to be amended, I would ask for a mover and a seconder to approve those as presented. Councillor Mayhew and Councillor Warwick. All opposed? And that's carried. We were to have a deputation this afternoon from KPMG, but they at the last minute are unable to join us. So I would like to ask for a motion to defer that until our September 14th meeting, I believe it is. A mover and a seconder for that, please. Councillor Vanderheyden and Councillor Elliott. All opposed? And that's carried. Any inquiries or notices of motion? Moving into reports, there are none, but we do have some things in front of us under new business. The first one is a report from Wayne from Telecommunications, and this is to do with a road use agreement. Wayne, I'll hand it over to you. And is he muted or is he even on the screen? Do I even see him? He was here.
He's just coming back in right now.
Oh, he's coming back on? Yeah. Okay.
And he's gone.
He's gone.
We might have to come back to him more.
Okay. All right, so we will then move on. Hopefully Wayne can join us. And we're pleased to be joined today by Dustin Carter, who's the Superintendent of Community Paramedicine. And he's going to be giving us an update with regards to community paramedicine for 2021. So it's great to see you, Dustin. I think the last time I saw you was at the closure of the testing center in Oak Ridge. But thanks for joining us, and I'll hand it over to you.
Thank you very much, Warden. It's a pleasure to be here today. Warden and County Councillors, thank you for having me to provide you with a brief update on the Middlesex London Paramedic Service Community Paramedicine Programming. Community paramedicine is a model of community-based healthcare where paramedics use their education and expertise in a non-emergent mobile integrated response outside of the traditional emergency role to provide immediate or scheduled specialized healthcare to vulnerable patients populations while focusing on improving equity in healthcare across the continuum of care and reducing non-essential 911 activations and emergency department presentations. The Middlesex London Paramedic Service Community Paramedicine Program originally started back in 2014 with modest pilot funding and marginal staffing. It has since continued to grow exponentially in size and scope and has become recognized as a leader for community paramedicine within the province. Due to more recent increase in investment by community partners and stakeholders in the Middlesex London Paramedic Service Community Paramedicine Programming, the program has continued to rapidly expand as a specialized division within professional standards to include the following. Those programs being community paramedicine for long-term care, the palliative care outreach team, health outreach mobile engagement, community outreach and support team, the COVID-19 response team, and community support services. The Community Paramedicine for Long-Term Care program is a Ministry of Long-Term Care funded program which is mandated to provide 24/7 access to community paramedics with specialized training for non-emergent procedures and services for patients who are waiting for placement in long-term care, or those who are soon to be eligible for long-term care, or those patients with specific circumstances or conditions. This new core programming launched in June of 2021 and has been effective in working collaboratively with primary care providers to deliver a range of community-based proactive and preventive primary care services in the comfort of a patient's home, utilizing an expanded scope of practice and dedicated on-call team of physicians. The palliative care outreach team is an adjunct to the core program, which is funded by Ontario Health West. This team provides scheduled and on-call crisis, pain, and symptom management for palliative patients in their home when resources are in demand. This program has enhanced our region's existing palliative care services while being noted as a critical provision of acute urgent response for patients in delivering high-quality palliative end-of-life care and support within our community. The Health Outreach Mobile Engagement Program was developed to improve the health outcomes and health equity of highly marginalized individuals who are experiencing homelessness, insecure housing, or are rostered with the London Intercommunity Health Centre by utilizing community paramedics to deliver mobile primary care services to people where they are at. The program launched in January of 2021 and has a significant positive outcomes such as improved access to decreased barriers and supports and services, development of trust and reduced stigma, timely access to care, and improved health outcomes for the highly marginalized population. St. Joseph's Healthcare London, the Canadian Mental Health Association, Elgin Middlesex, London Police Service, and Middlesex London Paramedic Service partner to develop a proactive crisis outreach and support team. This team provides a healthcare-led, police-supported community crisis response strategy for individuals experiencing mental health crisis. This team assists with medical assessments, de-escalation techniques, diversion from medical intervention where appropriate, and facilitation of transition to acute care when required to ensure positive outcomes for the individual. The COVID-19 response team is comprised of community paramedics assigned to special operations throughout the Middlesex London area. This team works in both fixed, mobile, and pop-up clinic locations designated to perform COVID-19 screening, assessments, swabbing, and vaccine administration under the Middlesex London Health Unit Associate Medical Director. This team has been critical in our region's response to the pandemic by identifying and isolating cases to help slow the spread, while also decreasing barriers to vaccine administration for vulnerable patients and marginalized populations throughout our region. The Community Support Services is a bundled service collaboration between Cheshire Just-in-Time Supports, Meals on Wheels, VO1 Help, Home Help, and Home at Last, Dale Service Caregiver Supports, and Middlesex London Paramedic Service. This bundled service provides wraparound transitional support to patients for 1 month post-hospital discharge. Community paramedics are the first point of contact with a healthcare provider post-discharge during the susceptible period to provide in-depth health assessments, routine monitoring, and to proactively identify and address risk factors related to possible readmittance to hospital. All programs have secured time-limited external funding to support the continued program development and expansion. And Middlesex London Paramedic Service has been responsive to requests from community partners and is hopeful for to form sustainable future programming or funding. Thank you.
Okay, thank you very much for that update, Dustin. I think it goes without saying, you certainly have a busy department, and you certainly have taken on other duties as assigned over the last few months. You know, it's funny when you said about when it started, when community paramedicine started in the county, and that was one of the first reports I think that you delivered when I just was first on county council. So hard to believe that all those years, that 7 years have already passed from that time. Any questions or comment from council? Councillor Vanderheyden.
Thank you very much through the ward, and thank you, Dustin, very much for that report. It was an interesting read, and it really shows, you know, especially now that we've had COVID. You know, it was important in 2014, and anything that you've done since then has been very valid and important. I'm not trying to make it less so, but with COVID happening, I think it really highlighted to me, especially, the importance of this program, and how you're doing your job to make people safe and deal with very vulnerable people that are in a very part of their lives where they need help and they don't have to now go out and get it. So when you were talking about, you know, that a lot of these are limited time funding because I think the province wants to see whether they work or don't work, it may be an opportunity for us to send a letter. I know you always send your reports in, but a letter of support from county council and all of us mayors around the county to say, you know, these programs are working for our citizens and we need to keep them going. So what can we do to help to facilitate that?
Dustin, did you want to chime in on that? And then I might have a comment.
So thank you, Warden, through the Warden to you, Councillor. First, thank you. I truly appreciate those kind words and the recognition for our services, community paramedicine program, and this the team success. It really does highlight their dedication and professionalism and their commitment to providing that level, that high quality level of supports to our residents in the Middlesex London area. And I do welcome that opportunity to help to discuss facilitating letter of support. As yes, I did indicate that all of the programming at this point in time they are time limited, but to that point, they are quite impactful and important to our region's healthcare services.
Follow up, Joanne?
Yes, if I could, just a quick follow up. Because this is so successful, and it is the London, Middlesex, London area, I think we need to highlight this and yell it from the highest rooftops, because we can't keep this a secret. So I totally believe that we need to do something to say, yeah, this is working, whether we have, you know, testimonials from people that have had the service themselves, or whether it's from us or whatever. I think we need to make this more public, because I don't want to give you more work, but I also don't want to not highlight the work that you're doing.
Council, I think probably Joanne, that maybe Dustin can work with Marcy or the staff to draft something that can come not only from us, but then come from each municipality as well, like you suggested. Councillor Warwick.
Thank you. And through the Warden to Dustin, again, thank you for your report. And I know I'm not the only one sitting at this table that has negotiated our different levels of support through our health system. And I think you're truly filling in a lot of those gaps that we find. And you know, until you've walked that path and seen what is covered and what is not covered and how we can be helped and how we can't be helped, it's definitely a path that needs filling in, and I think that the work that you're doing is great, and I thank you for that.
Through the Warden to you, Councillor, thank you very much again for those kind words.
Any other comments or questions? Bill.
Or maybe I'll just ask Neil a couple of questions, give him the opportunity to comment a little bit if there's other things he'd like to add about the community paramedicine program. I'm thinking, Neil, just about how you see things changing, the support that you've seen provincially for this, there's funding, those types of things. Maybe you can just highlight some of those for council while we're on this topic.
Thanks, Bill, and through you, Warden, to Councillor Vanderheyden and Councillor Warwick's comments about the letter. Certainly more than welcome, and AMO has been engaged at the MOU table with Minister Elliott and Minister Phillips, as well as Minister Clark, on the provincial expansion of community paramedicine programs throughout Ontario. And certainly that's gained traction. I don't have a lot of details on it because it was again at the MOU table, but certainly what I'm hearing is that the response by Ministers Elliott, Phillips, and Clark was extremely positive and supportive of community paramedicine and the advancement of it. Certainly what we're seeing, as Dustin alluded to, we have many programs that are ongoing. Certainly the Ontario Health is going to and is continuing to explore funding options to expand that as Ontario Health teams are up and running locally. So our local Ontario Health West team, which the warden sits on, that team is obviously working with Middlesex London Paramedic Service, but provincially, certainly Ontario Health is looking at the expansion of that, as well as the long-term care with the community paramedicine program that Dustin talked about. So community paramedics have been recognized not only by Minister Elliott, by the Premier himself, as being important and vital to it. And the warden knows firsthand from her discussions with the Premier's office on this. So we expect that these programs will continue. But as Dustin alluded to as well, there are other programs such as Coast or Home, which are 100% funded, and additional programs that we're dealing with. And most recently as well with the evacuees that are coming in from Northern Ontario. Community paramedicine has been asked to play a role in supporting the evacuees during their stay, as well as MLPS being on site as the plane arrives as well. So certainly, and hopefully, Bill, I'm addressing some of your concerns, but it is very diverse. It is expanding rapidly, and we continue to expect it to expand rapidly. Especially with what we would call a provincial design on community paramedicine throughout the province. So there's not that patchwork, yet there's that ability for each community to have their own desire as to what they would like to see within community paramedicine in their own communities. So maybe I'll stop there.
That's an important point, Neil. I just wanted council to understand is that, well, two things I really wanted to come out of what you said. One, the province has been very supportive of community paramedicine in recent years, extremely. I don't want you to come away with the impression that they're not, but really what we're fighting for isn't their support, it's that community paramedicine be part of the ongoing paramedicine program. So that's the second thing I want council to understand is that when we talk about community paramedicine, it's really outside the envelope of funding for how we're funded. Through the province. So it may look seamless to you and it may seem like it's all part of the same system, but it's not from my perspective in terms of how it's funded. So why does that matter? It matters in terms of how governance works. It matters in terms of how accreditation works. It matters in terms of how funding works. It matters a lot that eventually community paramedicine become part of the overall ambulance service for the region. And then I guess the third thing I'm hoping that you are getting from Dustin's presentation is we used to just say community paramedicine. That was it. It was a catch-all term. It's definitely not that now. I think, Dustin, it would really, a picture would be worth 1,000 words here where we show sort of the organizational chart of the different levels of community paramedicine and who's responsible for what. And I think that would really be helpful for council because it has become very specialized. From the early days, whenever community paramedicine was just you, to now being a quite an elaborate part of our organization. So that's really important for council to know too. This is a big chunk of what we do now. And it's only going to become a bigger chunk, right, Neil?
That's correct, Bill. I think Dustin will admit that he went from a department of one, Dustin, to a very successful program, and I'm not sure what your count is these days, Dustin.
It's more than one.
Well, and it's important to note what it's going to become, right? Like we have in our planning at MLPS, we're thinking about the long-term vision for community paramedicine. What does that mean for how we deploy? What does that mean for how we do things operationally? And even in our 5-year master plan that the RFP is, I think it's either out or just about to be out, community paramedicine is an important consideration. So that's why today's discussion is really important, because you're going to see community paramedicine be a constant discussion point as opposed to something once a year, I think, in the future. Thanks, Warden.
Okay, yeah, no problem. Those are all good points to be made. So certainly, you know, more to come as community paramedicine evolves and certainly grows, that's for sure. So thanks very much for that, Dustin. Certainly appreciate you being with us this afternoon. If I can just get a motion, mover and a seconder to accept the community paramedicine report for information, please. Councillor DeVete and a seconder, Councillor Mayhew. All opposed, and that's carried. Thanks very much, Dustin. Okay, we're going to circle back to Wayne, to the ATEL Telecommunications Road Use Agreement. Wayne.
And thank you, Madam Warden. My apologies, I did become disconnected there for a few seconds right at the wrong time. But through you to Council, ATEL is the successful bidder of a portion of the SWIFT project for fiber optic installation in Middlesex County, and in particular, this is in Southwest Middlesex. ATEL is agreeable to the county's blanket access and road use agreement adopted in early 2021, which provides access to county road allowances across the entire county for telecommunications installation, subject to the approval of engineering drawings, work permits, and the taking of necessary security. And the county's blanket agreement, it has focused on keeping the annual fee lower than other municipalities, while ensuring causal costs are covered to ensure that of no taxpayer losses and no subsidizations beyond what council has approved. So in this case, the $784,000 provided to SWIFT. And this agreement is being used by both the county and Southwest Middlesex in this case, which provides for ease of project discussions and administration. And to date, the county's agreement has been agreed to by all the various successful proponents of the SWIFT fiber installation project and other telecoms and other projects as well. In terms of furthering the county's strategic goals, the START projects provides connections to their infrastructure, cultivates Middlesex community vitality, and strengthens our economy. And the county certainly appreciates telecoms acting in Middlesex County, supports them as community contributors, and looks forward to the build out of the SWIFT project and other fiber initiatives. So the recommendation is for the ATEL Access Road Use Agreement to be approved and endorsed.
Thanks for that, Wayne. Are there any clarifications or questions from council on this? Councillor Mayhew.
Thank you very much, Madam Warden. Wayne, thank you for that presentation. Southwest Middlesex are fundamental in the discussions with ATEL, and we are very pleased that high-speed service will be available. When I see the word ATEL, I think I would be amiss as mayor of Southwest Middlesex, not to mention some disappointment from my residents. I support Wayne's recommendation here, but ATEL was a name that was unfamiliar to the residents of Northwest Middlesex. Of course, as you know, North Frontenac, or Southwest Middlesex, North Frontenac Telephone Company was on everyone's mind. When they approached Appin and Melbourne, the word ATEL came up, and there was disappointment in the fact that the pricing service that they were being offered was approximately 234% higher than North Frontenac Telephone Company. the preliminary talks with North Frontenac, the public meetings, things of that nature, that name was in every kitchen household. And then we hear of Atel, and the residents of Melbourne and the residents of Appin are receiving the same service level as Glencoe, for instance, and paying 234% more. So there was some disappointment there. And as I said, there are some people that would accept fiber installation at any price. But there are many that are looking at and comparing the price schedules of North Frontenac to Atel and wondering why there is this disparity in costs. And in fact, not only that, the service is somewhat lower than what North Frontenac Telephone Company are providing. So I just, as I say, it's my duty to represent my constituents. And when they are disappointed and my phone starts ringing and they ask me reasons why, and I'm unable to provide that answer to them, I would want County Council to be aware of that, that feeling of discontentment within Southwest Middlesex. Thank you, Madam Warden.
Thank you for that, Councillor Mayhew. Not sure that anybody on the screen can reply to any of those comments. That might be more of a discussion for the SWIFT group, and maybe those comments can be passed on to them. Councillor Vanderheyden.
Thank you, through the warden. I will pass that along. And I think this issue goes a lot deeper. It has to go to the regulator, the federal regulator, to start putting things in place across our country and our province and our area, because the Intel, everybody seems to have their own packages, and some are good, some are not, and some are making a lot of money off of a lot of people that they shouldn't be. So I'll just leave that one there. But I was under the impression that Glencoe was getting North Frontenac, so that this was a surprise to me. My question, though, before all of that, was to do with, we have all these road use agreements because this is where the fiber is going. At what point is there a shared service as opposed to just more fiber going in and more roadsides? Like there has to somewhere along the line, in my opinion, and I'm not an IT expert. If a really good fiber goes down the road, why aren't we all able to use it? Why do we have to stick with one company or the other company or the other company? And to Councillor Mayhew's point, 234% higher. That's ridiculous. So there has to, like, the consumer has to have some clout here. But I guess then back to my question is, like, are we confident that we're not getting overcrowded in our roadways?
Well, I don't know. I see Chris has come back on. I don't know whether he can take that on.
Well, through you, Madam Warden, I have a little piece on this. Okay. If Chris may have a comment, but I did want to let the councillor know that our agreement does require the sharing of infrastructure and the sharing of the road allowances as much as is allowed by the CRTC. So we do have as much sharing as possible. We try to share conduit. We have it reserved in these agreements that we can tell companies to share, and we can tell them when the road allowance is full. And so in terms of enforcing that, we do have as much as we can in these agreements. And Chris, did you have any comments?
Through the warden, I'd echo exactly what Wayne says. I mean, we've prescribed locations within the right of way for this type of infrastructure, understanding we need to reserve other spots for natural gas, hydro, any kind of other utilities, sanitary sewer, water main, those types of things. So we're fairly confident, especially in these in some of the rural areas where we have lots of right of way. There's not a demand to urbanize these sections of road, that we have less challenges than in a sort of a densely populated urban area where these types of arrangements, are sort of less common because those areas are already more likely to be serviced with decent broadband infrastructure already at this point. So, we definitely hold a very big stick, I would say, as far as our municipal powers to, enforce sharing of infrastructure and those types of things. The agreements that, legals and engineering teams have come up with are very good in that respect. And it's certainly our intention to make sure that it's an equitable distribution of space within our right of way for the general good, not specifically for broadband first and then everything else. Everybody gets the same sort of crack at space within the right of way.
Okay. Any follow-up, Councillor Vanderheyden? Okay. Any other comments or clarifications from council? All right, so you have a recommended motion in front of you. If I can get a mover and seconder for that, please. Councillor Cornelissen and Councillor Warwick. All opposed? And that's carried. Great, thanks for that, Wayne. Moving on to councillor comments. Councillor Cornelissen.
Thank you, Madam Warden. I wanted to share with everyone that the new board for the Middlesex London Housing had an original meeting on July the 15th. This board is compromised very similar to the original board that was disbanded some time ago. There's members of residents of community housing on it, members of the community, and of course, councillors. Councillor Squire was appointed by the city, and he was in fact elected as chair of the board of this board. The other councillor has not yet been named. In addition to that, a committee was formed, established to begin the process of choosing an ongoing CEO. Andrea McKenzie is coming to the end of her interim term. And there was 140 applicants, and they'll reduce that to 4 or 5 to be considered by the board at a future meeting. There were some HR and some staffing updates. Other than that, it was just a light agenda, just a review of recent activities of the board. Thank you.
Great, thanks for that, Adrian. Any questions for Adrian on that? Okay, any other councillor comments? All right, then we will move on to our bylaws. Marcy.
Thank you. We have bylaw number 7126, a bylaw to authorize the warden and the clerk to execute a telecommunications municipal access agreement with ATEL. Bylaw number 7127, designating prescribed rates of speed on county roads number 1 to 81 inclusive. And number 7128, a bylaw to confirm the proceedings of the August 10th meeting of council.
Great. Can I get a mover and a seconder for the first and second reading, please? Councillor Ropp and Councillor Richards. All opposed? That's carried. And for the third and final reading, Councillor Brennan and Councillor Smith. All opposed? And that's carried. So we're moving into the committee of the whole, and we are ahead of schedule. We're supposed to have a delegation with United Way. They're scheduled at 2, so we're going to keep moving because our next action, we'll just go right into action items because Mark is already here and he can join us if he's listening, and he can give us a report on the European gypsy moth. And over to you, Mark.
Thank you, Madam Warden. Good afternoon, Madam Warden and councillors and staff. Firstly, thank you for this opportunity to provide another update on the gypsy moth in the county of Middlesex. I think the last update I provided to council was June, July last year, 2020. So since that time, as I'm sure you're all aware, this pesky little insect has been, its population has been increasing somewhat, certainly down in this neck of the woods, which is southwest Middlesex, where the majority of the county woodlots are situated. The insect population can be best described as a boom and bust type population dynamics. And I think in the early 1990, there was a big outbreak that was monitored and recorded by the Ministry of Natural Resources. Again in the early 2000s, but it was a slightly less severe attack or outbreak, should we say. So slightly less severe defoliation in the early 2000s. It's supposed to boom every 10 years, but then it kind of went a little dormant for 20 years. So the next big outbreak that we saw in the county was the kind of 2019-2020 year, where the population was starting to really boom again. And the boom bust cycle can be so dependent on a number of factors: weather, climate, you know, how the insect interacts with its natural controls, the fungus and the virus and the parasitic wasp, and also from predation from birds and mammals in the woodlands. So, so anyhow, in 2019, 2020, we started to get some calls from some of the local communities, Campbellville, Kamoka, Kilworth, those kind of areas. And you know, mostly complaints from residents living in the peri-urban or the sort of urban areas, where they were noticing the moths were population was kind of exploding. So I think per my last year's update, I think you're all probably quite familiar with the life cycle, so I won't bore you repeating that. But the eggs hatch out in spring, and you get these little critters, the caterpillars. I think that's probably the most offensive to most people part of the life cycle, when the caterpillars are munching on the trees, defoliating the trees, and flying around on their silk threads. So that's, I think, when most people notice them more. So we did have, we noticed there was a fairly significant collection, or should we say reserve of egg masses over the winter, over last winter, from last year's population. So we were anticipating, and the Ministry of Natural Resources did some egg mass counts last winter as well, and kind of confirmed our suspicions that this year was going to be a little worse from last year. So a large population of caterpillars did hatch out in the spring and proceeded up the trees to munch on the leaves. I would say that from my observations, I'm out and about most of the time, as you know. Defoliation was most significant in the county woodlots. This year was definitely more significant than last year, but it tends to occur in kind of epicenters, little concentrated pockets, and along some of the edges of the woodlands. And I don't know the exact reason for that, but I suspect it has something to do with the fact that we as humans are the single most important trafficker or vector of the egg masses, either on ATVs or vehicles, or, you know, RVs and all that kind of stuff. So we tend to move the population around because the females can't fly. And unfortunately, these egg masses hatch out, and that's where the insect concentrations occur. So it definitely wasn't broad scale across the entire county woodlots, but it was noticeable along Centerville, and as you walk through the woodlands in quite a few pockets, but not, it wasn't freaking me out too much, for want of a better phrase, in terms of the forest health. So probably late June, mid to late June, the most defoliation was obvious, and most noticeable to residents and forest users, hikers, recreators, and myself, of course. And that's probably when you saw the most defoliation. Almost looked like the trees had gone into winter again, into their dormant season, and shed all their leaves. But of course, it was the caterpillars munching them that had defoliated the trees. But rather reassuringly, by early to mid-June, early to mid-July, get my months correct, the same trees had virtually fully refoliated, which is a natural response to defoliation. It's actually how bonsai people manage their bonsai trees. They prune it off and leave the petiole, the leaf stalk. And if you leave the leaf stalk, the tree knows that it's not the end of the world and it can produce a new leaf. And typically those new leaves, the new leaf mosaic is slightly smaller than the first leaf out, but it's still functional and photosynthesizes and produces lots of energy and food for the trees. So yeah, since that time, I've seen quite reassuringly, a lot of the, or during that time, I noticed a lot of the caterpillars were either hanging in this upside down V, which is a sign that the virus has gotten a hold of them, or the caterpillar body was emaciated and dried up, which is an indicator that the fungus, the natural control fungus, has gotten a hold of them and spread through the population. And as we know, the small parasitic wasp lays its eggs. It parasitizes the eggs earlier in the season, so that's not really so much of a factor. But I was definitely very, very reassured to see the caterpillars being coming under control somewhat. Quite a lot of numbers hanging there, but of course, with a population this large, as one would expect, quite a lot of the caterpillars have matured, pupated now, and the females are laying their eggs. So I would anticipate that next year will be somewhat similar, but certainly taking heart that the natural controls are kicking in and starting to, I think, move that population on the downward spiral, where hopefully it can stay for another 20 years when it collapses. And I think that's pretty much, I think I've hit all of my speaking points mostly. In the industry, it is very much known as a tree stressor rather than a tree killer. For sure, some of the trees may succumb, but largely you tend to see from repeated defoliation, you tend to see these mature trees, they're pretty smart, and they'll just allow for a little bit of crown dieback. So some of the upper crown will die back and they'll shed those limbs in winter storms or just naturally, and they'll reduce their crown size and the leaf mosaic, and then they'll start to recover. And that's because they're a self-optimizing living organism and a lot smarter than me.
Thanks for that, Mark. Do you mind just touching on the good neighbor policy?
Oh, yes.
And what that would look like.
Thank you, Madam Warden. So a couple of other jurisdictions, and I think a particular note, the provincial parks. So what they've done is they've entered into sort of good neighbor agreements with private residents who live and say back onto a large tract of provincial park or forest woodlands. And I think a couple of municipalities have done the same, where they've said, okay, if Mr. Private Residence, Mr. and Mrs. Private Residence, you want to spray your property, we would allow you to spray a 60-meter swath into the, or a 60-foot swath, or whatever the agreement is, over into the county or provincial park, and therefore create a bit of a buffer, I guess, to the insect population around the private property. And I think that's seems like a pretty decent goodwill gesture to allow for that for your neighbors. There are obviously some concerns as to what insecticide would be used, because we certainly wouldn't want to get involved in extirpating some of our rare Lepidoptera species. And as you know, the BTK, Bacillus thuringiensis, Kirsten, it is not discriminating. So if it kills one Lepidoptera, any moth, butterfly, it kills them all that eat the poison, so to speak, that's sprayed onto the leaves.
Okay, thank you for that update. I know Councillor Warwick and Councillor Elliott and I were actually in Lambton Shores last week, and we had a discussion about gypsy moths with the mayor, and they have a similar policy that they've adopted where they will allow abutting landowners to spray, but he did note the same concern because it doesn't just affect the gypsy moth. So Councillor Vanderheyden.
Thank you through the ward, and thanks for that report, Mark. I read it with interest because obviously we've all got lots of calls around this horseshoe. And when I was reading the national controls and also the intervention methods, some of them I'd heard of before, some of them I had not. Wondering, I hope we can share this with that a lot of people read this, because I think that answers a lot of the questions that people have given me. I know that my husband has climbed our trees more in the last year and a half than he has in his entire life, killing these darn things. And I just, he's getting that age either where I don't want him up in those trees because I don't want him landing on the ground. What do you think is the most effective? I mean, the spraying seems to be the most effective and yet almost the most dangerous. So and dangerous in what you just said, you know, that you're killing more than just when you're scraping the moths and and you're squishing the caterpillars, or you're, you know, doing any of that, you're only dealing with one species. But if you're killing more, that's probably not a good idea. So what would you recommend, if you could, as the person with the most knowledge around this table on this, what would you recommend?
Thank you. Through the warden, Councillor Vanderheyden, can you clarify a little bit? Is this for a regular homeowner or
Yes,
a woodland owner?
Regular homeowner. We don't really deal with the forest so much as you do. I get the calls from homeowners.
Okay. So I definitely wouldn't put myself in the category of an expert in regards to sort of managing single trees in the landscape, but I would say, I mean, certainly I would gravitate towards obviously the least environmentally hazardous or risky solution. And that would, if they're fairly small trees, you can literally treat it with safer soap. So the soap solution actually breaks down the caterpillar's body, the fatty body. So a safer soap is probably better if you're pretty sure that it's just those caterpillars that are in the tree. Obviously, if there's other caterpillars, then you get to destroy those as well. I think on a landscape level, probably the egg mass scraping is the best. Just get that done as thoroughly as you possibly can in your individual landscape, and hopefully it doesn't involve too much tree climbing and hazardous activities like that. But get an arborist to do it, or or try and hose the egg masses off the tree as well. You could always try that. They do wash off fairly easily, actually a little bit more easily than trying to scrape them off, because they get into that kind of deep furrowed bark, and they can be quite difficult to scrape out of those furrows and crevices. I'm not sure if that answers your question. Definitely hire a local pest control specialist, arborist type person, and weigh up your options and try and do it as least risky as possible to all the beautiful moths and butterflies that we do want here in our environment. I mean, fortunately, I think a little bit the timing of them hatching helps, because other of our native moths are a little bit earlier or a little bit later. So sometimes you can end up with just the one outbreak for caterpillars in your trees, and if you time it perfectly, then you lessen your risk of affecting desirable species, should we say.
Good advice for all. I like the advice of getting a professional rather than climbing the tree myself. Councillor Ropp.
Thank you. Through the warden to Mark. First of all, that's it's a really good report with a lot of education in it. And I'm hoping that we can attach it to an agenda at North Middlesex as well, you know, just to get that information out to people. Because it very much specifies what the sprays will do. Because we've had people saying, no, it doesn't hurt the environment. It only gets these here caterpillars, nothing else. And that's hard to believe. So it's good to see this report and for an education standpoint. And I agree that for us to spray is, it's not what we're about. But my question, I guess, to you is the good neighbor policy. When people do that spraying, so I will say from a local private-owned camps, for example, this past summer, there's places where you couldn't go outside. It stopped people from going outside. It was that bad. And so when it becomes that much of an outbreak, I will tell you that people were using anything from Raid on their trees and trailers and everything else, and it did kill them off. But so my question is, those options, once they get to that point, you know, you're past the egg point, you're past all that. Once you get to that point, really spraying them is almost the only viable option, isn't it?
Through the warden, Councillor Rob. So there's definitely still a little bit of a conundrum, because if you're spraying the tree, you're spraying it to apply the insecticide to the leaves of the trees, and then the caterpillars have to ingest that, so they have to still eat the leaves. So they still have to defoliate the tree before they've eaten enough of the poison or the insecticide to kill them off. If you were to spray with something like Safer's soap, it's more a contact insect, so you know it starts to break down the fatty acids in their body parts, and I think it's a bit of a cruel death, but it's more contact of the insect versus you know, say with the BTK, you have to still allow them to defoliate the tree before it has any effect. I did get a couple of calls this summer about, you know, following up from local spray programs where the residents were shocked that it hadn't taken immediate effect. And I think that's because there's probably an urban myth or just a misunderstanding that it's not a contact insecticide, or the BTK isn't. It has to be sprayed onto the leaves of the trees, and then they have to munch the leaves of the trees to ingest enough to kill them off. And if it's done too late in the life cycle, the moths actually just kind of fight it off. They just feel a little bit unwell, but they don't actually succumb to it. So it's a little bit more difficult. Whereas a contact herbicide, such as Safer's soap, would probably take care of it. I hark back a little bit to like my grandmother. You know, she hated having aphids on her roses, and she would always take her dishwater, soapy dishwater, and throw it over the rose bush after she'd washed the dishes. And that got rid of the aphids because it kind of breaks down the body parts. And I always wondered why she did that, but then I figured it out when I went to college.
Thanks, Mark. As I said, to the warden's point, I want to make sure as many people get this information and this report as they can. Thank you.
Councillor Mayhew.
Thank you, Madam Warden. And Mark, thank you very much. Mark, I can tell that report was given with some compassion, and I appreciate it. Not only that, your report, but Mark, you and I have had some dialogue previous to this. It should be no surprise that Southwest Middlesex was very interested in this, because we're home to the 2,000 acres of woodland. So our feelings toward this are going to be a little more intense than some of the others. As Joanne indicated, her concerns were on the private property aspect of it. Ours was on the skunk's misery aspect of it. I reached out to Dr. David Suzuki for his opinion on it, and I received a reply from him. And Mark, we know that Dr. Suzuki has a very down-to-earth, no holes barred teaching and communication method. And he gave an analogy, Mark, that spraying for gypsies moths would be like a mayor who is trying to control the element of crime in his municipality locks everybody up. And his letter ended shortly after that, and that's a typical Dr. David Suzuki style. I thanked him for that reply. I understood its meaning. Do you share that analogy? In terms of the spray is not zeroed in on one particular species, but it is endangered the whole community as opposed to one. And I think you alluded to that. That analogy, is it over exemplified, or is there some truth of the matter?
Through the warden, thank you, Councillor Mayhew. Yeah, I mean, I'm not an expert on metaphors and analogies and stuff, but I totally understand where he's coming from, and I think it probably boils down to the fact that we've seen too often with human intervention that we probably go a little too far in certain things, and there are these off-target consequences, and we always then express, or tend to express, some surprise that they've had all these off-target consequences, you know, so that you and that goes right down to introducing species we should never have introduced. I don't know, because maybe we felt, you know, that it was in our English country garden, therefore it should be in our Canadian country garden. And, you know, we've introduced species and plants and all sorts of stuff that we shouldn't have done. And probably that just reflects our lack of the full understanding of how an ecosystem works. And if you take one spoke out of the wheel, you know, it can have tragic consequences. Or if you start taking a number of spokes out of the wheel, then eventually you fall off the bike. And, you know, and it's really tough, you know. I mean, we've had this effect on our climate, and then we're like, oh, you know, I wonder why this is dying, or this is dying, or, you know, why the population is diving in this kind of species. And then when we analyze it, we go back to the basics. The science first shows us that it was us that was at fault. So yeah, I would much rather, you know, rely on the natural controls. I mean, they seem pretty effective, and they're pretty effective in Europe, where this moth is native. It's considered naturalized here because it's grown to the numbers where it can no longer be gotten rid of. So it is considered by the CFIA as naturalized, and I say, we wouldn't have any oak in European forests or many other species in European forests if this
it's 14 hours
had its way. Sorry, I heard something.
Yeah, no, I think keep going, Mark.
Oh, so yeah, it's not been a huge disaster for the European forests, and I don't think we should anticipate it's a huge disaster for our forests. It's certainly not welcome in people's backyards or patios or on the house sidings and that sort of thing. And we can't minimize that. We understand that you know, people's backyards and recreational areas are important to them. But in some senses, we are our worst enemy in some circumstances, because we transported it there to cottage country, and we've only got ourselves to blame. But on that happy note, maybe I hand it back to the warden, because she's far more inspiring than I
am. I don't know about that, but did you have any follow-up, Alan, or are you good? Okay.
I'm good.
Okay. Councillor Smith.
Through the warden, just a few comments on the gypsy moths. So I received a number of calls last year about the gypsy moths, and you know, I did take a look at these different areas in Adelaide Metcalfe where they were. Unfortunately, this year they seem to have traveled, you know, one road west from really where they were into my backyard as well. So I had the privilege of not, what Councillor Ropp was saying of, really staying inside. My house backs onto a woodlot, and we were not able really to enjoy our back deck because the caterpillars were, of the hundreds just dropping down, and hearing the caterpillar rain is what I like to call it, of, that gypsy moth poop falling down. And it's the most disturbing thing. I didn't really go outside for probably 3 weeks and enjoy our property. So squishing several of those the caterpillars, and doing the best I could with trying to stop the that next transition of the moths. And now having I bought a whole bunch of the gypsy moth traps, and I probably went a little overboard buying 8 of them, but the amount of moths that I have caught with those traps, it's unbelievable. And I'm hoping that, it makes it so the next year that there isn't as many of these horrible little caterpillars, because they are not fun and they're not enjoyable. But with that being said, it's, thinking about it from what Councillor Mayhew's talking about is, specifically the county woodlot, but it's very similar to what Councillor Vanderheyden's talking about in your own backyard and what to do. And in my thought process is that if we were to do something at the county woodlot, unless we do spraying across the entire county, it's not really going to stop the gypsy moths. It's one isolated area. Just like myself having all these moth traps out in my backyard, if my neighbors aren't doing the same thing, it's kind of a lost battle, because they're going to be spreading. They're going to be going on, continuing, to the next block and continuing on. I will say that in June, I was very, very scared for some of our trees, because, it was very bare bones. Like I could see right through them. But Mark, as you've indicated, the leaves, they do grow back. And I was very surprised to see that. And I'm very happy that that's the case. However, the one type of tree that I am a little more afraid of is the evergreen trees. So we've have some Christmas trees that we planted, along our property, and I was surprised to see that the gypsy moths also like to eat those pine needles, and those are the trees that are not going to survive as well as others. With your recommendation, Mark, I understand, what your recommendation is there, with the good neighbor policy, and that makes sense, and really just letting them take a course. I think that's the best thing to do, as much as I know a lot of residents would like to see us do something. But again, if we don't spray the entire county and then also get all the neighboring counties to do the same thing, it's really a losing battle. But with all that said, is there an opportunity, or what is council's thoughts on having, the gypsy moth, the actual moth traps, like having, maybe this should be a budget discussion, but possibly having, purchasing some of these traps, having them available at, say, the county libraries, that somebody can pop in, grab one to try to help, that next year's battle against the gypsy moths. Just an idea that I have. And the other one, other thought that I have with this is that I think we need to do, a whole social media campaign leading up to the next round of gypsy moth season in June of 2022, to make sure, people know what to do, what to look for, to hopefully battle this horrible battle that we have to deal with.
Okay. I think the budget traps, or the budget traps, the moth traps would be a discussion at budget. And certainly I think that's a great idea for social media. And then Mark, I don't know if you wanted to tackle anything that maybe the evergreen, if there's anything else that can be done for that.
Thank you, Warden, Councillor Smith. In terms of the evergreens, yeah, they're not as resilient as the deciduous trees. Fortunately, except for maybe trees in people's landscapes, fortunately, a much smaller proportion of our forests across the county is made up of the conifer trees. They're not able to regenerate the leaves the same as the deciduous trees are. So some of them will succumb to to repeated defoliation or severe defoliation. And unfortunately, that's just a fact of life with this particular beast. As regards to the pheromone traps, just want to clarify that the pheromone traps only catch the males. And I'm sure you already knew that, Curtis, but they only trap the males. So it only needs one male to not be trapped and to breed with the females, and the females just go about their business laying the eggs. So it's not the greatest way, and City of Toronto and other members of the forestry community recognize it. It's a good monitoring methodology to see what kind of what population might be in the area, but it's really not a control. It's not seen in the industry as a control because you're only catching the males. So it's, I'm not sure that it has
the effect.
Yeah, that much potential. As it might certainly makes people feel better that they're catching the male moths, but of course you have to dispose of them and kill them. They're not just like they don't pay prize when they enter the trap, unfortunately. So there is an amount of work you have to do. But it certainly, yeah, would help maybe contribute towards reducing the male population, but not the female population. As say, the females don't fly, so they're not going to be attracted to it.
No.
So that helps.
Okay, any other comments from council? Just before I ask for the motion to be made, Mark, with regards to the good neighbor policy, and you mentioned it right off the bat about, you know, what sort of insecticide is being used, I guess understanding that it's not going to be able to, you know, just just hit the gypsy moth. It's going to, you know, affect a number of different species. But within that policy, will there be anything in there for us to have a say as to what's being used, or how does that work?
Thank you, Warden. To be honest, to be frank, I haven't really given it a huge amount of thought to date. I think that's something that I would need to sit down with Dirk and the rest of the team and just figure that out. Probably legal would need to be involved as well, just to kind of you know, put a draft policy together if that's a route we wanted to go. But I hadn't really given it too much thought because we only have 18 residents, I think, adjacent to the county woodlots. So it's not a
manageable group to work with.
Yeah, it's not a big number. I'm sure it's not as big as it would be for, say, some of the provincial parks who are, you know, embedded in the community. But yeah, we just ran the quick numbers and it was 18, I think, residents. I'm just looking at Dirk for confirmation of that. Yeah.
Okay. Well, and as you said, there's a number of policies already out there, whether it's through our neighbors or whether it's through the provincial government. So lots of other policies there to work with. Yeah, for sure.
Yeah.
Okay. Any other questions? One final call. Okay, thanks for that report and discussion, Mark and council. You do have a recommended motion in front of you to have staff develop a good neighbor policy. If I can get a mover and a seconder for that, please. Councillor Vanderheyden and Councillor Warwick. All opposed? And that's carried. Okay, thank you very much, Mark. We'll look forward to that coming in at some time in the future.
Thank you very much. You're welcome.
Okay, thanks.
Thank you, councillors.
See ya. Okay, we're going to circle back now. Our friends from the United Way have joined us, and presenting to us today is Kelly Ziegner, the President and CEO for United Way Elgin Middlesex, and Heather Jackson, the Associate Director of Development for United Way Elgin Middlesex. Welcome, ladies. It's great to have you with us. And Kelly, I'll turn it over to you.
Great, thank you. Just by some logistics, should Heather share her screen?
Chris?
I've got the presentation ready, so I'll share it now for you. You can just say next and I'll move to the next slide.
Perfect, thank you. So thank you, Your Worship and members of council, for having Heather and I here to join you today, just to give you a little update about United Way and the work that we've been engaged in the past couple of years, but more particularly in light of the pandemic and some of the way we've sort of deepened our involvement in the county and the region throughout. I know most of you are quite familiar with United Way. We've either chatted before, you have supported United Way as a donor or through your workplace or through various initiatives that we've been involved with in the past. And so we are very grateful for that continued partnership. Our local United Way is an autonomous entity. We're part of a federated movement, United Way Canada. There's just over 70 United Ways across the country serving 5,000 communities, each one with an independent local board of directors. So we're governed locally. The money we raise stays local, and that continues to be our commitment, is really the focus on the local. Next slide, please. I'm not going to get into the United Way 101. As I said, I think most of you are quite familiar with what we're all about, but in recent years, we've really deepened our focus on poverty and equity. And all of the work that we're doing is really to give folks a fair shot at a good life, no matter where they live in our region, and by offering programs and services that alleviate poverty, prevent poverty, or increase equitable access to programs and services to help people succeed. In February 2017, our United Way merged. So we were formerly United Way London Middlesex, and we went through a merger with United Way Elgin St. Thomas. And that's been a really powerful learning for us. So as United Way London and Middlesex, I would say we were very London focused, which would probably have been a critique that council would have had of us and our county partners would have had of us in years prior. But through our merger, we really have taken a deeper focus on understanding the needs in rural and smaller communities throughout our region, both in Elgin County and in Middlesex County. So it really has been quite transformative, I would say, for our local United Way and our local region. Often mergers sometimes get thought of the big guy in the merger has all the answers, but really it was through that shared learning through all of our partners, our volunteers, and our agencies that we're really becoming more intimately aware of some of the needs in our whole region, not just being so London centric. Next slide, please. So we invest in 3 community impact priorities: poverty, helping kids be all they can be, and building strong and healthy communities. And all of that is through an equity and poverty lens. So for example, we do fund mental health services, but those mental health services would be for folks that couldn't access it through, workplace benefits, for example. So it's subsidized counseling for people that can't afford it. Same thing with children's programming. It's ensuring that kids have access to recreation and tutoring and mentors alongside their peers that may be from higher income brackets or other, sort of neighborhoods. So we continue to look at these 3 particular areas, but always through a poverty and equity lens. Next slide, please. And as I mentioned right off the top, everything raised local stays local. So what gets raised in Middlesex County and Elgin County, we then reinvest right back out into those communities. In our last fiscal year, $350,000 was invested in programs and services physically located or head office sort of located in Middlesex County. That's in addition to a whole range of programs, as you'd be really aware, that maybe have a London footprint, but then they have satellite programs out in the region. Examples of that would be Youth Opportunities Unlimited in London, but also operate the Next Wave Youth Center in Strathroy. So there's many of those programs that are shared because they have a larger footprint than just in the county. I'm really proud to say that we have a lot of leadership and staff involvement from the county as well. So we do have representation from Middlesex County, not just London, on our board of directors, on our campaign cabinet, in our community fund allocations process. So voices from your community are part of the leadership and the direction of our local United Way, of your local United Way. Next slide, please. We are also participating in a number of community planning tables that you'd be really familiar with that are happening throughout your county and the region. And we do that to really get an understanding of what the needs are in the local communities. Sometimes we are the initiator of those planning tables, and sometimes we're just an added voice or even an observer, so that we can understand what's happening from a needs perspective, so that when we're investing as a funder, we're doing that in a coordinated fashion, and we understand how those social programs are connected to the county's existing social service strategies, so that we're not doing things in isolation. So we're deeply engaged in a number of ways throughout the local county. Next slide, please. Last year when the pandemic hit, we weren't quite sure what we were going to do as a United Way. It was right at the beginning of our fiscal year, and you think the whole world shut down overnight. And what does that mean for an organization that relies upon fundraising revenue? And so we, like many organizations, we were very concerned and very cautious when it came to how we were going to operate in the last fiscal year when the pandemic first hit. So we contained, our own expenses. Our staff entered in a work share agreement. We worked with our agencies and delivered their funding on a quarterly basis, so that we, weren't spending more money than we had. But all told, it really is an incredible story of commitment and generosity from our local communities, as we were able to invest the most amount of money ever in our local region through the pandemic. Some of that is dollars raised through donors, through workplaces, like United Way typically does. And we found that folks that were in the position to give, gave more because they knew that their neighbors needed it. And then we partnered with the federal government on two large pots of funding, one, the New Horizons Seniors Fund and the Emergency Community Support Fund, to invest additional dollars back into the community. So the federal government entrusted United Ways across the country to take this pot of $350 million, work with our local community foundations and Red Cross to be able to deliver those funds right back out into the community. Next slide, please. In Middlesex County, what did that look like? So we invested $247,000 in COVID-specific relief programs, in addition to our regular community fund. And so we were able to serve agencies across the region. These issues are not, will be very familiar to you. This is what we were hearing from agencies, issues related to access to broadband, so that kids could learn, so that agencies could deliver online counseling. Issues of transportation and isolation also were a really concern, and food security. So those were a number of the investments that we were making throughout the county, in London, and also in Elgin County as well. A few of the other programs that we were involved with was 24/7 texting support through Reach Out, outreach phone calls to isolated seniors throughout the region, just to make sure that they had a warm voice and someone to check in on them. Next slide, please. These are some of the agencies that we're funding out in Middlesex County, just so you can have a quick idea of what that looks like. And last year, nearly 7,000 people, Middlesex County residents, benefited from a United Way supported program, which is about 10% or 1 in 10 people in your county are accessing United Way funded programs and services. So it's quite significant. And we're pleased that we're able to be able to do that on an annual basis. And we did that through 72 programs at 43 agencies across the region. Something new this year is our community fund model. So that's how you probably know us best as a funder. We raise the money and then it gets distributed with the input of our allocations volunteers out into the region through different agencies. For many years, it was a very closed process. We had a really good, we still do have really good working relationships with many agencies throughout the region. But it became crystal clear throughout the pandemic that folks that were most vulnerable and most marginalized were being disproportionately affected by the ravages of the pandemic. And it became really clear that us as a United Way, in order to level the playing field, to make things more equitable, that it's important for us to open up our funding process. So this year, for the first time in, I think, decades, we will have an open call for grant applications beginning in early fall. So you'll see more information, and I encourage you to take a look at our website. That's where everything is. And if you know of organizations that maybe haven't traditionally been funded by United Way that might be a good fit, encourage them to look at the funding criteria because we are on the look for building and strengthening new partnerships throughout the region we serve. Next slide, please. And finally, just want to wrap up with a little bit of conversation or to let you know some work we're doing as it comes to advocacy and public policy. So United Way has often been known as a funder, sometimes known as a community convener, but lesser known as an advocate and engaged in public policy. And that's new for our United Way. We haven't been so deeply connected in advocacy, save for maybe the last 5 years or so. And I mention this because I think we all know that providing meal kits is a Band-Aid solution. It doesn't affect, sort of the long-term change that's necessary. Long-term change comes at a policy level. And so we're working as a local United Way, but also connected to our provincial partners in United Way and our national body to get deeply involved in public policy work and advocacy. And I think we can be an important ally for you as a county council. And when in your advocacy, particularly the higher levels of government, when it relates to equity and poverty, things like access to transportation and how important that is, we can lend our voice to those calls for action to higher levels of government. So please connect with us when the time is right or appropriate and you think that we could lend our voice to some of the same issues that are concerning you as a county council. And I think that's all that I have for now. Happy to answer any questions now or offline. You feel free to contact me at any time or our United Way, and we're happy to answer questions and get connected. Thank you.
Great. Well, thank you so much for that presentation, Kelly. And there is no question, you certainly are connected in community. And thank you for the work that you do and support. Any comments, questions from my colleagues at council? Councillor Vanderheyden.
Thank you through the ward, and nice to see you, Kelly and Heather, both. It's been a long time, it seems, for sure. Well, thank you for the presentation. You know, it's really important for us to keep involved with the United Way, to know what's going on, so we can actually, you know, promote the organizations, the programs in our communities. So I have one statement and one question. So the statement is, I noticed that the last slide, which we have in our package, is to do with the housing. And that is so important for all of us right now. Sometimes we don't see it because we live in rural areas, and it starts out as couch surfing. That's with the younger population. With the last year under our belts, we have, as a Women's Caucus, seen very large gaps for women and children in services and help that they require to get through. And that goes all the way from mental health to childcare and caring for elders and caring for sick people in your own home, of your own family, where you can't even get the supplies in order to help. And we saw that a lot and heard that a lot from a very wide area in Middlesex County. So, you know, if you don't have a safe place to live, the costs have become so incredibly high. I've had people call me in tears because their landlord is selling the home, because a landlord can make more by selling the home right now than to renovate it or keep it up to any kind of rental capabilities. And of course, there's nothing to rent. So then that cycle begins again. So I'm glad you have that on your radar. So I really don't need any answers there. I just wanted to say thank you. I guess what my question relates to is, you spoke about other organizations and programs that we need to let you know about if we see them. So how do you vet those organizations? How do you figure out which ones to support and which ones not to? That's my question.
Yeah. So through this open call, we're going through a two-step process. So people will sort of apply and give an expression of interest, and we'll have some conversation to see if they're an appropriate fit. We are bound by the Income Tax Act, so we can only fund qualified donees as defined by Revenue Canada, so they have to be a registered charity. Now, there is some work, and we are supporting this advocacy work, a bill before the Senate to broaden that scope, particularly for grassroots agencies to be able to apply for funding from funders like us. And we think that's an important measure, particularly as it relates to narrowing that equity gap. But that work is still going, and that legislation is still pending. So that is sort of the first brush. And then we have a set of criteria that my staff and as well as a volunteer team look at. So, you know, we would have volunteers who are chartered accountants, who are involved in social services, who are involved, you know, maybe from a legal capacity, who review funding applications. And we have a rubric of criteria that they need to be measured against. So it's pretty thorough. Anyone who's been involved with the United Way funding application process knows it's a lot of work. But some of that's really intentional, and it's important to us as an organization and to our donors to ensure that we're making the best possible investments. So often, you know, particularly right now with an open call, we're really open to having, you know, one-to-one conversations. Give us a call. We're going to have some information sessions where organizations can sit in and get an understanding if the kinds of programming that they offer through their organization would be an appropriate fit.
All right, thank you for that. Any other comments, questions? Okay, well, with that, thank you very much, Kelly and Heather, for being here as a support. It was great to see you, and certainly we look for continued updates as to the work that you're doing, specifically in Middlesex. So thanks for that.
Great, thank you.
Thank you. Have a good afternoon.
Bye.
Okay, so we'll jump through onto the into the agenda. Our next set of action items are the reports from Cindy that I believe we are going to defer until the September 14th meeting when KPMG has rescheduled. So Cindy was going to have 3 reports, and if I could just get a motion to defer all 3 of them to the September 14th meeting. A mover and a seconder for that, please. Councillor Richards, and a seconder, Councillor Elliott. All opposed? And that's carried. Okay, next on the agenda is the approved capital budget project, HVAC updates or upgrades, excuse me, and this is from Strathmere. So Brent, over to you.
Thank you, Madam Warden. Through you to Council, the Lodge's major capital budget project for 2021 is a substantial upgrade to our heating, ventilation, and air conditioning system. Further to approve funding of more than $2.2 million from the Investing in Canada infrastructure program. The project will not only remedy current cooling system shortcomings, but it will also improve indoor air quality and improve air filtration in keeping with current infection prevention and control best practice. So in short, the project will lead to improved resident comfort and overall well-being, while minimizing future county costs related to the Lodge's HVAC system. Investing in Canada infrastructure program funding timeframes call for projects to be substantially completed by the end of the calendar year. So to meet the tight project timeframes, the Lodge wishes to contract with Woody Stollert Engineering to provide the necessary technical expertise and project oversight to implement the HVAC project successfully. Highlighting that our Investing in Canada infrastructure program funding does provide for $25,000 in professional fees, I am recommending that Council approve the Lodge entering into an agreement with Woody Stollert Engineering at a cost of $43,000 before taxes and additional fees and disbursements. Happy to entertain Council questions.
Great, thank you, Brent. Questions? Councillor DeVete.
Thank you, Warden. Through you to Brent. Thank you for the report. I think this is probably a really easy question. I just wondered, is the cost of the engineering oversight and the project management piece included in the, is it eligible under the CIP funding piece? Or is that a budget line item that I don't recall in the budget?
So the approved funding includes $25,000 for professional fees. So
okay,
it is assumed that $25,000 of the $43,000 is covered through that funding.
Okay, thank you kindly.
Okay. Any other questions or clarifications? Councillor Ropp.
Thank you. Through the Warden to Brent. Brent, I'm in favor of the project. That's not an issue at all. I just was curious, do you know at this time, with the scope of the work, will there be a lot of inside work changing in the ventilation, or is it mostly an external rooftop?
And through the Warden to Councillor Ropp, it would be, as you're suggesting, mostly external.
Okay, thank you.
Anything else from Council? Okay, so you have a recommended motion in front of you. If I can get a mover and a seconder for that, please. Councillor Ropp and a seconder, Councillor Mayhew. All opposed? And that's carried. Thanks, Brent. Moving on to our correspondence and information items. General payables, July 6th to July 30th, 2021, totaling $320,564.85. Planning payables, July 6th to July 30th, 2021, totaling $10,255.12. Social service payables, July 6th to July 30th, 2021, totaling $342,245.30. Strathmere Lodge payables, July 6th to July 30th, 2021, totaling $164,850.87. Transportation payables, July 6th to July 30th, 2021, totaling $1,822,227.71. MLPS payables July 6th to July 30th, 2021, totaling $990,017.28. ITS payables July 6th to July 30th, 2021, totaling $243,167.06. Economic Development payables July 6th to July 30th, 2021, totaling $15,612.23. Electronic payments July 2021, totaling $2,342,921.79. Electronic payments for June 2021, totaling $2,208,695.56. Can I get a mover and a seconder to receive those for information? Councillor Cornelison and Councillor Warwick. All opposed. And that's carried. City of London resolution appointing Councillor Cornelison to the London and Middlesex Community Housing Incorporated Board of Directors. Letter from the Solicitor General, re Pet Safety, July 8th, 2021. Middlesex London Board of Health meeting update for July 15th, 2021. Notice of study completion for Thorndale Bridge. OPP Highway Safety Division preventable fatal collisions. Councillor Vanderheyden.
Thank you, Madam Warden. Just to speak to this one just a little bit, because this is something we've been talking about so much in the last couple of years about road safety and, you know, accidents happening. And I found it, again, just incredible when I read these statistics that, you know, as of July 26, 2021, 138 people have died in 131 fatal motor vehicle collisions on the OPP patrolled roads. And that the data revealed that of the road fatalities involved one or more of the big four leading causal factors in road deaths. And they were alcohol and drugs, speed, driver inattention, and lack of seatbelts. Those are all absolutely, in their words and in my words, senseless, preventable deaths. And they should not happen. If we are ever to get to zero fatalities on our roads, we have to somehow get the education out there that a road is there for you to get from place A to place B. It's not for you to act like you own the road and are the only one on it. And when you're, you know, watching your phone when you're driving a car, or whether you get in there when you're drunk, there is just no excuse for that whatsoever. It bothers me so much, because usually the person that gets hurt is not you. It's usually the people in the other car that are totally innocent in all of this. And so I don't mean to get all in everybody's face about this, but I think it's just absolutely ridiculous that this is still happening. And it's you know, we try to make the roads as safe as possible, and we live in the country, and there's a lot of slow moving vehicles. And if you think that you're the only one that needs to get from point A to point B, you're wrong. So let's all do it safely. Sorry, that was a little speech.
No, I think that you summed it up perfectly, Joanne, and I think you probably echo what we're all thinking. So thank you for that. OEB notice, Enbridge gas rates 2022. Letter from Cargill revaccination clinic for July 22nd, 2021. Letter from Deputy Minister Kate Manson Smith, re Main Street Recovery Act, August 3rd, 2021. Letter from Minister Clark, re Municipal Modernization Program funding, joint payroll, human resources, and scheduling solutions. Letter from Minister Clark, re Municipal Modernization Program funding, joint asset management system solution. Letter from Minister Clark, re Municipal Modernization Program funding, joint development review and approval process modernization. Letter from Minister Clark, re Municipal Modernization Program funding, joint procurement process review. Letter from Minister Clark from Middlesex County Warden, or letter to Minister Clark from Middlesex County Warden, Municipal Modernization Program funding approvals. AMO policy update for July 8th, 2021. AMO policy update for July 20th, 2021. Budget variance report, June 2021. I'll just make note, I trust everybody got the email that Marcy sent out earlier today on that. Okay, can I get a mover and a seconder to receive those items for information? Councillor Elliott and Councillor DeVitt. All opposed? And that's carried. Any inquiries? Any new business? So we were to have a closed session this afternoon with regards to a property matter, and we've deferred it a couple times. We're going to defer it again, but the motion actually is that the property matter be referred back to staff to gather further information. So if I can get a mover and a seconder for that, please. Councillor Richards and Councillor Brennan. All opposed? That's carried. We've got our next list of meetings and it'll be in September 14th. Can hardly believe that. And then of course, the golf tournament is just after that on the September 16th. And I know I will see some of you next week at AMO. So with that, I would like a motion to adjourn at 2:42 p.m. Mover and seconder, please. Councillor Vanderheyden and Councillor Smith. All opposed?